Thanks for listening to Looking Forward Our Way. We'd like to ask a favor from you. Would you give us some feedback on our podcast?
We've made it really easy to do so. Click on the link in your episode show notes. That link will take you to our podcast's Google My Business page. You may have to sign in to your Google account.
From there, we'd appreciate your feedback on the podcast overall, feedback on a specific episode, or a suggestion on what you'd like to see us cover in a future episode.
All your feedback is so much appreciated. Your comments only help us create episodes that will keep all of us looking forward our way.
So we are recording a podcast live at the first annual WordBridge Now Summer Celebration of Educators. I'm Brett Johnson. I am the husband of Dr. Angela Weimer Johnson, who owns WordBridge Now, and she's asked Circle 270 Media, company I own, to be here to record a podcast that I co-host with Dr. Carol Ventresca called Looking Forward Our Way.
Hey, Brett. How's it going?
I'm doing great. And
Good.
This is the second or third time we've done a live podcast.
I know.
Or at least on location. This one now in front of an audience, in front of speakers. So we're very happy that our guests were willing to be guinea pigs as well, too.
We're not really sure how this is going to sound, folks, but thank you for hanging in there with us.
Yeah.
But no, we're on the road now that we are not wearing masks and we're vaccinated. We can be on the road. So, so Brett, I'm pretty excited. And as we were just sort of chuckling, you and I are very famous for bringing our friends onto our podcast. This is networking at its best and probably abusing friendships, but that's okay. It works.
That's okay.
So we're on location here in Dayton, and I'm very pleased to introduce Dr. Sara Guerrero-Dubey to our audience. Sara is an assistant professor of pediatrics at Wright State University and has been a pediatrician for decades, working with children in Ohio. Vicki is a managing partner at CBD Advisors in Dayton, serving the healthcare community in its efforts to create sound legislative policy for our Ohio citizens. And as I said, I have my friend Sara Guerrero-Dubey here. Sara and I were in high school together, and that was just yesterday. So thank you both for joining us today.
Well, thank you. Thank you for having us.
Good. Well, Sara and Vicki, before we get into details of the discussion, could you give us a little bit of overview of your backgrounds, your role in pediatric care in Ohio? Let's start with Sara.
Oh, thank you very much. I am a pediatrician. I graduated from the Ohio State University undergrad and School of Medicine.
Go Bucks.
Go Bucks. Thank you. And I completed my internship at Nationwide Children's. It was called Columbus Children's at that time. And then I, like a lot of women of my era, followed my man, John Dubey, Dr. Dubey, to Houston, where we completed our pediatric residency there. I had a Air Force commitment, so then my husband followed me into the Air Force for his dependent spouse role of 3 years, and we were stationed in Massachusetts. And so as payback for that, John has made me move multiple times in our 40 years of marriage, and we are back in Dayton. We were here originally in 90. We left in 2000, and we came back in 2015. And I keep changing jobs every time John has a new job. And I've been in primary care for decades, and it's kind of easy to get a job as a pediatrician because there's always a need for pediatricians. I'm currently as Carol said, assistant professor of pediatrics at Dayton Children's Hospital. I'm a general academic pediatrician, so I provide primary care, but I also train the future pediatricians of this community, and I really love that wording. Actually, Vicki provided that to me when she said, I train the future of pediatrics, and I love that. Thank you.
Exactly. But also a shout out for Sara, because she has been literally around the world in doctors' programs taking care of children in areas that need pediatric care.
Carol knows my secret. I have done actually, after my kids got old enough to be a little independent, like in high school, I have done multiple kind of small medical mission trips, and I had the opportunity to go to Kenya, to Vietnam. Annually, we went to Honduras. And actually, I haven't done a medical mission in a different country for about a decade because I realized that the mission was actually here in the United States. There was a lot more that needed to be done here. The social determinants that have been affecting of children in the United States, and particularly in Dayton and in Ohio, was growing, and it was massive. And I decided to stop doing mission trips and needed to take care of the kids close to home. So,
and a firsthand look at the difference that vaccines make.
Absolutely. Fortunately, in my career, I've seen, and I was going to talk about the 7 greatest achievements of the last 40 years, which is how long I've been married, and in medicine, in pediatrics, and immunizations by far lead the list of the achievements that we've done for children. And we've wrapped a cocoon of protection around children with the public health efforts of car seats and smoke alarms and fire-proof clothes and being able to treat leukemia. Kids don't die from blood cancers anymore. But also things that may be a little more remote for people to understand, but preventing HIV transmission from mothers to the babies. Actually, Dayton, Ohio has been the epicenter of the opioid epidemic, and I was amazed when I came back here in 2015, the number of HIV-positive mothers and their babies that I was witnessing. The babies, if mothers get treatment even late in their pregnancy, they do not transmit that virus, that deadly virus, to their babies. So that's a huge achievement in the last decade. And, of course, the Back to Sleep, which is preventing SIDS, sudden infant death syndrome or crib death. These are all public health measures that we've been using for 40 years, and it's been amazingly successful, and we need to continue that. So I was lucky to witness that.
Sara, thanks. I know your schedule is crazy, so thank you for joining us today. Vicki, I've kind of taken us a little off the path here.
No, that's okay. I'd love to hear Dr. Guerrero-Dubie talk about her passion for kids, because I share it. I just don't get to treat them the way she does. I'm jealous. My business partner and I are public policy, government relations consultants, and I started my career in sales and business development for Procter & Gamble and some corporate companies, and then went to Dayton Children's and became a hospital administrator and was there for 24 years and found really my calling. I have a passion for working on child health policy and making sure that our kids are represented when policy is being made. I've never met a politician who didn't say they were for kids. But as Sarah's heard me say before, I always ask who's for kids and who's just kidding, because it really is about, and I've been an elected official. I know how hard it is. Please don't get me wrong. I'm not criticizing. I'm just saying, kids don't get to vote. And so we need people in the room who are talking about their needs, who understand them. And there are no better people than that than pediatricians. And I say this to my elected official friends in the General Assembly all the time. Pediatricians go to school longer to make less money over their careers. Mm-hmm. These are people who are doing God's work for our kids. And so I love to get them in front of elected officials because their passion is real. And I'm just lucky that I get to talk about it and be just a tiny part of it.
Wonderful. Well, thank you again for joining us today. Okay, Sara, let's get going here. We can first discuss the research and implementation of COVID-19 vaccines for children under the age of 18, and we want to go over that. But let's first talk about the fact that younger children, the situation's still a little unclear as to what's going on with the vaccine.
Well, the vaccine, there are 2 vaccines that are approved for children over 18, and I still call them children because they still, when they come in my office, I say, get your vaccine, even before it was approved for 12 and up. And there was a provisional approval, but now there's a full approval for 12 and up for the Pfizer vaccine. It's a 2-dose vaccine. It's been very effective. And when we talk about being effective, when people complain about the flu shot, the flu shot probably works 50% protection every year. We're talking 95% protection with the COVID vaccine. Actually, both of them, Moderna and Pfizer, have amazing, totally unheard of protection vaccines. So they're very effective. And I know people were concerned about the side effects that children perhaps may get. They're no different than what we've seen for the adults. They have been rare, but it's the typical side effect: soreness at the site, fever, fatigue. Fatigue usually about 10 to 12 hours after getting that first dose, people will say they were exhausted. They may have some temperature. And at 24 to 48 hours, bam, it stops immediately. I mean, it is your body going, whoa, look at this. I got something new that I have to recognize. Now, they start making the antibodies, and in that 12 hours of kind of feeling lousy, they're making antibodies, and boom, it shuts off at 24, 48 hours, and people feel fine. And so it's amazing for people to have consistently that reaction, because it tells me that the vaccine's working, Betty. And we expect that by the latest January, we'll probably have the vaccine approved for children probably down to 6 months of age. So very safe, and allowed thousands of doses to be able to look at the effectiveness and the type of side effects that we're seeing.
Well, and I think, too, that just like with adults, there's always going to be some reaction. It's never 100% effective, and it's never going to be the same with each person. And folks are taking it to an nth degree of concern when there might be, what was the one when there were 23 women who had blood clots out of the millions of doses that were given. That's not to negate the 23 women who got blood clots. That's critical. But considering what the circumstances are, what the outcome could be if they didn't get the vaccine, it could have been a lot worse if they had gotten COVID.
Absolutely. We tell people every year with the flu vaccine, the flu vaccine wasn't designed to keep you from not getting the flu. It keeps you from dying from the flu. And that's the same thing. We're using that same line. It sounds mean to say that to people, but literally we're telling them the COVID vaccine is keeping you from dying from COVID.
Right.
And I don't think of a better offer that I could make to someone.
Right. Yeah. Well, the anti-vax movement has been around for a long time, maybe somewhat underground, I guess you could say, but it was there. The information they provide has been proven wrong in more recent scientific studies. However, it would seem that they found a new voice or platform with our goal to fight COVID-19. Vicki, are there specific situations or cases which are used in their fight against vaccines? And if so, has the science proven them wrong?
Yeah, I mean, I think it's unfortunate that, a lot of times, particularly on social media, you'll see, studies, and I always say that with quotation marks, cited that have proven wrong. And in fact, the one that people talk a lot about is the researcher in England who said that vaccines caused autism and then, doctored his studies. They weren't real. He's in prison, but yet somehow, that continues on. It continues on because it gets perpetuated. I would say the vaccine opponents have really, I like to say rebranded, and I've started this focus on medical freedom and really found some allies in those folks who are concerned about civil liberties. And, I think when you see, I look at a lot of studies about social media traffic, and what you see in the numbers, particularly on Facebook, is that community's membership has increased dramatically over the last couple of years, really framing vaccines as an issue of values, civil rights, and medical freedom. And so, I think the partisan divide, over the pandemic response has given another opportunity for people to drive that wedge in there, and it sort of has reinvigorated the anti-vaccine movement really nationwide, but particularly here in Ohio, it seems like we're the center right now. I think those opponents of vaccines saw this as an opportunity, and frankly, they've brought more people into the fold, really talking about this fear of we're going to mandate you or we're going to keep you from engaging in community and social activities if you haven't had a vaccine. And I think it just appeals to a new set of people that, say, well, gosh, I'm for medical freedom. What does that mean exactly? And so it really, to me, is not exactly truthful in the sense it's not, truthful is probably not the word. It just doesn't explain what's really there. And so I encourage people to dig below that,
And that seems to be the issue. We don't have people taking the time to dig in. Maybe we just don't have the time to do it. I get it, but we just seem to see things on the fly on social media, like it, share it.
Yeah,
because
and that's the danger.
Because it says exactly the way I feel at this moment, and I didn't do any research in it. And it's scary.
And I think people on, I would say that people on social media have gotten really good. I mean, sometimes you see those things and they look like they're from, I've gotten them and I think, wow, it looks like a real media outlet, or it looks like somebody shared it. And when in fact, when you dig a little deeper, and I always encourage people to follow the money. Find out who paid for that. Find out where it came from, because what you'll see is it may not be what you thought it is.
Right. And we interviewed a news director, it's been in the news forever. And his quote was, and I've heard this before too, is that we kind of gravitate toward the news provider that we agree with, rather than being informed. So it seems like we're just gravitating toward anything that's fed to us. That, yep, I agree with that. I'm going to like that. And
then the algorithm is such that you get more of that.
Get fed
and then if
that,
you're bombarded by that, it's difficult for people to be able to, particularly, during COVID when you're kind of shut off from everybody.
Because that's the reality now,
right.
is they're being fed that all the time. It's like, well, there's nothing else out there.
It's hard. And I feel for people, because I think people want good information. That's why, I encourage them to talk to their medical professionals.
Right. Well, it's what I find really confusing is they've put together this fear-mongering of you're going to hurt me or you're going to hurt my kid and you're going to force us to do this, and freedoms which I don't necessarily agree with, but it's the same as other controls that we have going on in the country, that people have different opinions as to what should and should not be legal.
Right.
So they're fear-mongering parents to not take a vaccine, when in actuality the issue that they're really trying to get at is, you're stepping on my freedom. It's such a fine line, but it brings in a lot of people that maybe that's really not their issue. They're just still afraid because of their kid.
Yeah, I mean, I think people have, Dr. Guerrero-Duby, often has talked about you got to talk to parents in the right way and address their fears. And one thing I would say is that, I think people have a right to be afraid. I mean, I think COVID, I was afraid of COVID. And, I think people have that right. But I think, and you have the right to be free. You really do. But at what cost? So if you're a member of a community and you are a member of society, you have to, do certain things to be good citizens. And I always look at vaccines as what we do for each other. Mm-hmm. And, I was one of those pediatric cancer patients, and I just turned 60. I'm the luckiest woman on earth, because when I was 18, I'm lucky, and so I need vaccines because it protects me as somebody who has a, compromised immune system. And so I feel like when somebody gets a vaccine, they're doing it for me too. And so I think that's how we have to look at it, as opposed to something they're doing to me. It's something we're doing for each other.
Right.
And for our kids.
Right. Mm-hmm. So we now have a legislature in Ohio and likely other states that are more than willing to listen to the anti-vaxxers, as well as those who fought against Ohio's role in controlling the pandemic. I mean, we discussed a little bit our former health director who had, people with guns in their front yard. Let's first give our audience an overview and historic look at public health roles in our lives and how vaccines have been part of that, and how it's been saving our lives for decades. We've gone from an average age of 40 to 50 to now an average age into the 70s, 80s, and pretty soon into the hundreds.
I certainly think that people need to remember the public health efforts that actually probably came from the 1918 influenza pandemic that the world, but certainly this country saw, and recommendations for masks were part of that. And it was a simple thing to do, but they realized that it was effective. That was at the very beginning of trying to devise vaccines. And it was interesting. During the pandemic, I read the book about the influenza vaccine of 1918. It was pretty heavy. I won't say boring, but it was pretty heavy. And I liked it because it did talk about all the work that went into getting a world to realize this thing called a vaccine could help them be healthy. And but the initial measures of cleaning, of wearing masks, people knew that cancellation of activities and closing of movie theaters and schools was needed so that you wouldn't be exposed to this influenza. And they really didn't know what it was. This marasma of illness was what they described it, because they hadn't really described the viral particle at that time yet.
Right.
But so people did it because they knew they had to. It was right at the World War I was going on. Our young soldiers actually were shipped out to Europe, and they actually spread the influenza virus to Europe and then to the rest of the world. But the world did the things that needed to be done: masking, cleaning, isolating, because they knew they needed to. And then finally, in our lifetimes, and probably a little bit before that, when they developed vaccines and antibiotics, they were able to say, "Oh, I remember polio, I remember influenza,
Right.
I remember diphtheria, I remember all the things that killed my great grandparents and my other relatives, and wow, I'm lucky enough to be able to be vaccinated against it." So the public health measures were embraced the same way car seats eventually were embraced, seat belts. People don't complain about those now. Materials, I think I mentioned before, materials that are not flammable for children's wear, especially their sleepwear. These are routine now, and everyone understands that. They accept that these came as public health measures. And somehow or other, since the measles and autism scare 20 years ago, people have embraced a lack of trust in the vaccines because they haven't seen the diseases before. And so the young people don't remember polio. They don't remember a lot of the things that we saw routinely. My husband was talking about during the internship, especially down in Houston, which is a huge community compared to Dayton or Ohio in general, where they lined up the newborn babies in the nursery for their spinal taps. Because so many of these babies had meningitis. They were infected shortly after birth. And the interns now don't even know how to hardly do spinal taps because they hardly see these kids, because we've eliminated a lot of these diseases that routinely killed the babies or left them markedly disabled with brain damage and other significant injuries. And our young interns don't even see these diseases anymore. So that's why people have kind of forgotten, and they kind of forgotten the responsibility to everyone else to get vaccinated.
Right.
To prevent it.
The only thing I think I saw on Facebook through this whole crazy world we've had over the past year was a comment that said, the only thing that replaces good science is more good science.
I like that.
And that, I mean, we revel in computers getting better, revel in cars getting better, revel in all of these things. But why is it in medical science people are getting healthier and living longer, and yet we're questioning it? That makes no sense.
That's a great point, Carol.
So I also think it's a great point. Somebody pointed this out to me the other day, a medical practitioner who said, we're very concerned about vaccines, which are 95% effective, as Dr. Guerrero-Duby said. And we're so worried about the side effects, but they take medicine that has 2 pages worth of side effects. 2 pages. So a lot of us take medication to live and to be healthier that has pages and pages of potential side effects.
And none of us can read it without a 10-level magnifier.
But most of us accept it.
Right.
And so I just think it's interesting that we have this sort of debate when we accept it in other places, and I'm grateful for those drugs, and we accept the risk with those drugs because of the life that it provides us, and vaccines are the same.
If you're willing to take aspirin, which has side effects,
it's
just interesting, I think.
It is. Yeah.
It is.
Well, House Bill 248 was introduced in the Ohio legislature to allow Ohioans to say no to vaccines, basically. However, it will have much greater repercussions than just allowing individuals to avoid the COVID-19 vaccine. The new legislation is going to greatly impact how safe children will be in school, the increase in life-threatening diseases, which have been basically eradicated with vaccines. for both children and adults, and how we move into the future with disease prevention. Vicki, can you provide an overview of the impact HB 248 will have?
Sure. It's a very broad piece of legislation as it's currently written, and it applies to any and all childhood vaccines as well as others. It really is about prohibiting mandatory vaccinations, vaccination status disclosure. So in other words, all of us have rushed to the pediatrician. Sara Guerrero-Duby, you probably hate that time of year where we go, I need my child's vaccine records. It would prohibit any school, university, public entity from asking for vaccine records. And it authorizes an individual to be able to bring a civil action if they feel like, a violation has occurred where somebody has required a vaccine and they didn't want to comply. I think for hospitals in particular and healthcare, it would prohibit employers, and particularly hospitals, from requiring vaccines. And so best practice in this country through the CDC, Joint Commission on Healthcare Accreditation, is for healthcare workers to be vaccinated against the flu. And most hospitals make it mandatory. There are exceptions for religious or health issues. But then if you exempt out of taking the vaccine, you're required to wear a mask during that flu season from the first day that they detect the flu till the end. This would prohibit both of those things. So you wouldn't be allowed as a hospital or a healthcare or any employer to mandate whether somebody gets a vaccine. And you also would not be allowed to mandate whether they wear a mask. It would prohibit an entity from maintaining a record of vaccinations for children. So, let's say, God forbid, there was an outbreak in a daycare center. You may not know who's vaccinated or not, which from a public health standpoint is so very critical. I think the other thing that I think worries a lot of pediatric child health folks is that when a daycare center school would notify a parent that their child's vaccines are required, they would also be required to notify that same parent with the same size font in the same way. I mean, it says that there are options for exemptions, and here's what there are. And so they make it easier for people to opt out, which, somebody would say, well, they should be able to, but sometimes people opt out for reasons other than like, I just don't have a doctor. I don't have time to take them. And we want to make sure that people understand there's a lot of people who get their kids vaccinated because they need to for school, and that's okay. So that's really what this bill does.
You realize if this passes, there's more strict regulations for me to put our dog into the kennel.
That's right.
For overnight stay, because he must be vaccinated for rabies and influenza. Otherwise, he cannot stay there.
And you have to have proof of that.
And you have to have proof of that.
Right.
So,
and just think if he wasn't required to have rabies, and suddenly we had a flock of animals around the country who were biting children or biting anybody with rabies. We've gotten rid of those diseases.
Right. So this bill seems extreme.
Well,
what's the end game? If you can speculate, I guess you could say, but what are they really wanting to do?
I think first I would say elected officials in the General Assembly need to listen to everybody. That's the beauty of it is that you hear people from all sides.
Right.
And people who introduce legislation were elected by their community to do so. And so I think we have to give them that respect. I feel very strongly about that. And I think we have to give them that respect. I think there are, again, some thoughts about civil liberties that drove people to this. And sometimes when legislation is written, it's not necessarily always about what you do. There are a lot of unintended consequences.
Right.
And so I worry about two things. One is this is very broad, and I'm not sure. I'm not in their head, but I would wonder if they realized what doors this would open. I don't know. The second thing I would say is that even if you strip out a few of these things, it's still very concerning. Hospitals have to be able to doctors need to be able to do what they need to do to keep us safe. And I loved what you said about, why isn't it okay if science is still learning? What we learned what we knew at the beginning of the pandemic,
Right.
to what we know today, 18 months later, is like, I don't know, Dr. Guerrero-Dubie, it's huge.
Dark ages to light ages almost,
Right.
isn't it?
Oh,
Yeah.
absolutely. And when we talk about, I know sometimes people think doctors want children to be vaccinated because they have a fiduciary benefit from having somebody come in. What will be also missed, and I think Vicki made the comment, parents are kind of forced to take their children in for checkups because they have to get their vaccines, which are required. But when they come in for those health checkups, that's when all the interventions are done. So we notice if the child is failing to thrive. We notice the developmental issues. And here with the pandemic, we will notice if the adolescent is having some mental health issues, which we know is almost a epidemic in itself right now. And so if children are not required to come into the doctor, and Vicki, you were right when a lot of times parents will say, oh, I just don't have time to take my kid in, as their only excuse for signing a paper that says to the daycare, and they wouldn't even have to do that, to say, I'm not getting the vaccines because my philosophical, rather than that it was, I just didn't have time to do it. And so those opportunities will be missed to bring the child in to assess all the other health issues, particularly the mental health and developmental issues for children. One of the things I had a father who, his child, I think it was a custody thing, but he brought the child in, and I said, well, we really need to update his vaccines. He hasn't been in for a while. And it was like looking at his watch, and he goes, well, I really need to go. And I said, well, you'll probably have a form because school has already been in for several months. He's 7th grade. He has mandatory shots. He goes, I'll just sign some philosophical paper that I don't have to do it. I don't have time today. And I really said, that's not a good reason to allow your child to catch meningitis. I did go into catch cancer down the road, to catch any of the whooping cough and tetanus. And the father just was going to decline the vaccines merely because he didn't have time that day. And we did get it done, by the way. But there are lots of parents who, in their attempt to take care of their children, and they are good-hearted, and the father was there, he brought him in, but then there's just so much that people can do. And so having the opportunity to go into the doctor because you have to have a form signed is actually a very good reason to bring them into the doctor.
Well, it's certainly going to turn doctors into bad guys, quote unquote, isn't it? I mean, you already had to play that role.
We do that.
To a certain, and you
Right.
probably do already to a certain degree. But
for years we've been spending lots of times, educating the parents, trying to not be the bad guy. And they've talked to pediatricians. I'm a strong advocate for vaccinating children. I'm a strong advocate for not having families who don't vaccinate their children to come to our office. And I've done this in multiple practices that I've been, because most practices take care of high-risk patients, immunocompromised patients, infants, babies who haven't had a chance to start or complete their vaccines. So if our waiting room is full of patients who don't vaccinate, I'm risking my other patients, and I think those families have a right, a freedom to protect their children from vaccine-preventable diseases. So we, at our office, we do tell parents that if they choose not to follow our recommendations for vaccinating, that they need to provide another healthcare provider. We actually give them a list of people in the communities, and there are plenty of doctors who will follow, but we choose, since we are experts in what we do, we strongly believe in vaccines, and we cannot risk our patients who are at great risk of catching diseases in the waiting room. That's how contagious they are. So that's a strong statement, declining to have people to come to your office. But we allow them to make their choice, but we do not allow them to risk our patients. So, and that's not even always followed by all the pediatricians, but because the medical centers very often are following the most complex children, it makes it a little harder for us to allow a large influx of patients who are not vaccinated, who could be contagious to our patients, to be in our waiting rooms exposing our children.
Well, and it seems like it gets to what you just said. Prevent getting a disease that is curable, that is
Vaccine preventable.
Yes. I mean, it seems like that's common sense.
Well, and it also feels as though, again, going back to this passage, if it does, okay, so all of a sudden you have these practices that are anti-vaxxer practices and vaxxer practices.
Yeah.
My gosh.
And
I mean, you
know,
talk
and that's
about
not what you want.
No.
You want to be able to talk to families. And, somehow this has gotten very politically charged when it really is an issue about healthcare and public health. And, I have friends who've decided to homeschool their kids because they felt very strongly about not vaccinating until a later age. They were worried about side effects and development and those kinds of things. And if you want to do that, I think that's fine. If that's your choice to do that. But if you've ever seen a baby with whooping cough, it is one of the more, I've seen a lot of things in my 30-some years in working in pediatric health. It is one of the more heart-wrenching things that I think I've ever seen. And it can be deadly, and so I think that's the thing. Like, I had somebody say, well, chickenpox isn't deadly. It can be. Flu can be deadly. Flu is very deadly in kids. So, it's easy to say that. I had somebody say to me recently, well, COVID's not that bad. Well, I had several friends who died from COVID. So, why would we take that chance is my view. But I want to be respectful of other people's views. I want to be respectful of other people's fears. What I would rather is that we could have conversations that aren't politically charged.
Right.
Right.
And when you're really looking at something like this pandemic, and actually all of these curable illnesses with vaccines are global. This is not just Ohio. This is not just the United States. We're a real small number of people in this whole global world. And if we're not controlling it in our world, just think how in areas that you can't even get to. You can't even get the vaccine to these people.
And one of the things I wanted to throw in about Ohio, we already have a very lenient vaccine policy. A lot of states don't have a philosophical reason to decline the vaccines. Ohio already has a philosophical. Parents don't have to get a medical statement that says from the doctor that they're refusing the vaccines already. We just ask them to show to the schools, and the schools can decide if they want to allow the child to be admitted. But Ohio already has a very lenient policy about vaccines required for school. We have some of the lowest vaccine rates in the country. And what has happened in the past year with the pandemic, the vaccination rate has declined 50% across the United States in just the last year. So if we have a more broad allowance of not vaccinating, that vaccine rate will go even further down, even faster. So I think people don't realize that what a difference a year has already made. This will open up a Pandora's box of even more diseases rising again.
Devastation,
absolutely.
I mean, how can we be so concerned about our children if in actuality we're not making sure they're healthy is beyond me. So let's get back to our and this discussion has been phenomenal. Thank you so much. Back to my next question regarding how to let ourselves be known about this. I really think that what's happening with the anti-vaxxers is, a few people are talking really, really loud, and all the rest of us sort of throw up our hands and say, well, they're kind of crazy. Nobody's going to pay attention to them. And they do. Legislators do pay attention. I just wanted to remark, I heard a story on the news this morning, the hospital in Texas, where they were requiring all of their staff to be vaccinated. And 170 some said no. And that sounds like a lot, but it was actually only 1% of their population of employees that said no. But there are healthcare professionals, and so they were looking at it from the perspective of their job is to keep patients safe, just as your waiting room should not be full of kids without vaccines. So I want to make sure that our audience has a clear idea on that this is so important. Even if you don't have children or grandchildren, this is important for generations of making sure that longer lives are possible in the U.S. we've been so excited about the fact that, people are living into their 90s and 100s. Well, if they die when they're 2, that's not going to happen. So, Vicki, give us some tips. We don't want to be just the squeaky wheel. We want to make sure that we can get our information across to our legislators.
Yeah, it's a great point. I think if you're a member of a community, doesn't matter whether you have kids or not. If you own a business and you want to hire people in the future, you got to make sure they're healthy and they're well educated. I mean, that's, to me, it just is if we want our future to be bright, what we have to do. So I think everybody should be a citizen lobbyist. When I told my mom I was leaving my full-time job as a hospital administrator to do this work full-time, she said, don't tell anybody you're a lobbyist, because she's like, everybody says that's the swamp. Lobbyists are great. They're a part of our political structure from the very beginning. And really all it means is that you're speaking out on behalf of. That's really all it means. And so we should be citizen lobbyists. The most important step, register to vote. If you're not registered to vote,
true. You have no right to say anything.
Don't pick up the phone because honestly, the people in those offices were voted by an electorate. And if you weren't part of it, so I always say that.
And you don't have to vote for the person you're calling, but you had to have voted.
Exactly.
That's right. You don't have to have voted to call them, but be a part of the process is my point. Yeah. And once you've exercised that privilege, the next step is to know who your representatives are. And it's super easy. You can call the Board of Elections if you want, or you can, as my mom says, use the Google. And, it's, you just go to ohiohouse.gov or ohiosenate.gov, put in your address, and it tells you who they are, gives you their address, their email address, and their phone number. And so once you have that, pick up the phone, shoot them an email, and tell them what you think. Share your voice in a positive, constructive way. Make it personal. So in other words, I'm Vicki. I live in your district. And I'm a parent, I'm a grandparent, I care about this issue because, and tell them you're for it, not for it, ask them where they stand on it. Almost every legislator has a coffee or open house in the district, and it's published on their website or somewhere. Go to it. Ask them a question. Say to them, I live in your district. How do you feel about vaccines? How do you feel about public health? How do you feel about I've even asked one, how do you use science in the decisions that you make? So, I mean, those are the kinds of things that you can do. When you do engage with them, remember it's a really hard job. Somebody said to me, they're dumb. I don't want to call them. Well, that's not true. They're doing a job. They were elected by someone. Enough people thought they were good at this to elect them. Show them that respect, and make sure that you're positive. If you want political discourse to be positive and productive, then you need to be that way as well. My dad used to say, you're either part of the problem or part of the solution. And, I think if you're silent when things are happening and then you're upset about it, you're part of the problem. So we need to be vocal. And the other thing I would say is, I think we get the government we deserve. And so, frankly, if you're not engaged in it, and somebody will say, well, why did they do that? Because the people who were engaged in it pushed for that.
Right.
And so right now there's a lot of people who are silent thinking, oh, they'll never do that. Well, they keep count. I mean, I had a legislator tell me a couple of weeks ago that they had more calls supporting this legislation than they had had on anything else. They said nobody's calling to say they don't support it. And when I talk to people, they would say, well, they're never going to do that. We need to let our voices heard. So as of yesterday, they had gotten over 2,000 emails and phone calls saying they don't support it. And they were people from Ohio. Right. Some of the folks, sometimes on these issues are not from Ohio. And they're shaping policy for us who live here. Let's be vocal.
Right.
All you have to do, Dr. Guerrero-Dubie said, what did you do? You called and said what?
Oh, well, I called and just said, I'm Sara Guerrero-Dubie, and I live in Oakwood, Ohio, and I oppose House Bill 248. thank you for all of that you're doing. I usually do thank them, just so that I'm nice. And
It's
the
a lot
aide,
of work.
right,
That's right.
It is.
the aide that answered the phone said thank you, and you could almost hear the pencil just making a hashtag. They just want to know what your view is, where you live, and it was very quick.
And see, I think a lot of people think it doesn't matter, but it does matter. They count. You know, they know. They count votes, and they count calls, and they count emails. And so we can't expect them to vote for things that influence that are for us if we're not engaged.
Right. And I think that's appropriate for all levels of government.
That's exactly right.
Your county commissioners, same thing. If you don't like what's going on in your part of the woods,
Right.
Right. I was on city council. I was the mayor and vice mayor, and I would go to the grocery store and people would stop me and say, you know, we got to fix that. And I took that to heart because they're my neighbors. They're my community. They're the people I represent. I live here too. And that's the other thing I would say. They live in your area. They're not making lots of money. There's a misperception that elected officials have, you know, these jobs and they're making, that's not true. They live in your community. So make sure they reflect you.
To be a little more specific too, because this is in the Ohio House right now, so it's most important to talk to your House
Absolutely.
representative. But should you also go ahead and talk to your Senate
Absolutely.
representative,
Because
the
the way it
governor's
works-
office, and everybody else?
Because if it is voted out of the House, it would go to the Ohio Senate. And then ultimately it lands on the governor's desk, who, by the way, has been an incredible advocate for kids from the time he was a U.S. Senator to today. Regardless of politics, I always say, you know, when it comes to kids' health, I'm for who's for us. And there are elected officials right now who are for us as meaning kids. And he certainly is one, as are many of the members of the House and the Senate. But yeah, you got to let them all know.
Right.
You know, and you call the Senate and you say you're a senator in this community where, you know, we're broadcasting from. It's Senator Bob Hackett. And you say, Senator Hackett, I want you to know I'm concerned about this legislation in the House. And I want to know where you stand on this.
Right.
well, we've got the nation watching us too.
That's right.
I mean,
Right.
there
Oh, yeah.
are templates being made from what's going on here.
There's a lot of this. This is a national push. It's a national movement, and they brought it to Ohio because they thought there was an environment for that.
Right. And you don't have to contact all of the representatives.
Nope, just yours.
Just your own. Okay.
Yeah.
Wonderful.
Well, as we usually do when we're able to with our episodes, we provide resource sheets. Now, obviously, there is a lot of voices out there pushing against the anti-vax movement. But, Sarah, do you have some specific information, websites, research that we can provide listeners?
Well, I'm always in telling parents that they need to educate themselves, and that's really the most important thing. And they'll come with something on their cell phone, and they'll show me just an article or something. And I usually tell them, you know, the American Academy of Pediatrics maintains a website, healthychildren.org. is sponsored by the American Academy of Pediatrics. It's geared for parents. The handouts that I brought today are written for parents. They have lots of questions. You just type in your question and they can answer and provide the information that the pediatricians follow. I strongly recommend the CDC. I know sometimes nationally the CDC, especially with the pandemic, has gotten a bad reputation, probably just because people were angry and they needed to be angry at someone. I love Dr. Fauci, but I'm one of his groupies. But I always tell people the CDC's information is science-based. I actually am the last 2019 was the last year that the CDC gave out their state awards for immunization champions, and I'm Ohio's last immunization champion for 2019. They were kind of busy in 2020 and 21 with the pandemic.
The pandemic, that's
so
right.
they weren't,
That's right.
They weren't giving out awards,
Yeah.
but you know, I'm a strong believer in the science behind the websites that are on the CDC. So I tell parents to go there, and you can find the good information and not just typing in a question on Google that says, are vaccines safe? Because by who clicks, the anti-vaxxer information comes up first. So going to healthychildren.org or the CDC to get good information is what I tell parents.
And I think part of our message is you may not like the answer. That doesn't make it wrong. You know, that's, I think what is a lot of what's happening is because, you know, the dad was too busy to get the kid vaccine. It's like science is in our way of living our lives, but that's not true.
Well, and I think, the research shows that women spend more time choosing a doctor for their children than they do for themselves. I mean, that's the research. Mm-hmm. And so I always tell, my daughter has, I have 2 incredibly smart, wonderful, bright, gorgeous grandchildren.
Yes.
They are the smartest, best ever.
Oh, sure.
Yeah. So
Absolutely.
I tell my daughter's friends who ask me these questions, you have spent an enormous amount of time choosing a pediatrician. Go to them, talk to them,
listen to them,
and air your concerns. Right. Well, we can't. This is not about shaming parents. This is about educating parents. And so I encourage them to go to their doctors. Another website for folks who are interested in good policy is the Health Policy Institute of Ohio. It's healthpolicyohio.org, and they are nonpartisan, and they advise legislators, governments, and entities about all kinds of topics. And they produce something called the Ohio Health Value Dashboard every year. And it's really a composite performance measure of how Ohio shapes up in terms of health and healthcare spending. And I'm sad to say that Ohio is 47th out of 50th in health value. I mean, we are really saying that Ohio is living an unhealthy life, and we're spending more on health because of that. And so vaccine, for every dollar you invest in vaccines, you save $10 in healthcare spending. So it's really about healthcare and quality of life, but it's also about that value for our dollar.
I was going to point out when you mentioned about that dollar, when kids are sick with vaccine preventable diseases, they miss school, parents miss work, the economy, the education of our future children, all can be negatively affected if we start seeing a rise in vaccine preventable diseases. So it's not just I'm making a choice. And I know you said that the homeschool parents, sometimes they want to wait until later to get their kids vaccinated. But a lot of times kids end up being sick with something before you get a chance to vaccinate them. And we're always told to kind of share a story. And we had a 2-week-old who came into the office for their normal well visit. One of the residents saw the baby, and mother didn't realize that the baby felt hot, and the baby had 103 fever.
Oh my goodness.
And so, of course, that baby was rapidly assessed and admitted to the hospital. If that baby had been 2 months old or older, we actually would have calmed down a little bit, because the first set of vaccines would have probably already been in. We would have known that maybe the baby has a virus, but probably doesn't have some of these things that we are really going to be treating them for when like the 2-week-old that we admitted to the hospital. So I think that people don't realize the fact that the vaccines can work, and it just is totally different on how you manage a child. And it's not just us. The recommendations are such that we have such confidence in the vaccines. The protocols all over the world would say the vaccinated baby would only need this small amount of stuff, and probably 99.9% of the time you're going to be correct in assessing that baby. The unvaccinated baby will have 1 million more things done, $1 million more dollars, prolonged hospital stay for the difference of not being vaccinated. So it really is an impact that's not just my choice when my child is homeschooling before they go to school and be vaccinated. It is impacting the future of Ohio.
So this really goes kind of into my last question. And I was laughing with Sara earlier because the sociologist in me forces me to ask this question and I know it's huge, and I know we can't talk about everything in it today, but what's the future of public health going to be? I mean, I have never in my life seen what has happened over the past year and a half in degrading public health officials, in threatening people because they are telling you to wear a mask. They're just, I don't know. I'm still amazed.
I think if I can just throw in that, the fact that everyone is so very happy now that the numbers are going down, realizing that over half of the people in Ohio are vaccinated with COVID, seeing the disease and the death going down, I'm hoping that people will look back and say, what were we thinking? That this really is very good. So I'm hoping that the proof will be in the pudding, or whatever the saying is, that they'll see the benefit that vaccination did allow us to open up a lot of the things that our normal life that we want. And so I'm hoping that that will prove to people that the public health policies are for their benefit and not to take their freedom away. And I just want to throw in, DeWine has done a wonderful job with this state. I had friends from other states who commented all along that Ohio was doing a good job. And political views aside, I agree. He has always been for kids, and he's a big supporter of the reading programs, as Mrs. DeWine is. And so they've always been for kids, and he's just done a bang-up job. And I really want to compliment. And any of the Dr. Acton, she's also another one of my heroes. I want one of her bobbleheads. I don't have one. I have a Fauci bobblehead.
There you go. Oh, my gosh.
But these are my heroes. And so he did a good job, and I just wanted to throw that out there.
And I think in watching how Governor DeWine approached the science of the pandemic was inspirational, really, for a lot of other people too. He really looked at the science, and so you have to give him credit absolutely for what he did in controlling, because as bad as Ohio is in terms of our health concerns, it could have been a lot worse. We could have been in real trouble, and we avoided a lot of it, which is probably why people think it wasn't important to do.
Yeah,
because we avoided it.
Yeah, I think that's really the catch-22. I think Dr. Guerrero-Dubie said it best. Public health is always one of those things where if you're wildly successful, nobody appreciates you.
Exactly.
You know what I mean? Mm-hmm. Because, well, what were we all upset about? But if you eat at a restaurant and you get E. coli, we have to remember that there's a lot of public health outside of the pandemic. They are keeping us safe with food inspections and all, lead inspections. And I get why people don't necessarily trust government institutions. You think about, the water situation in Michigan where
right.
people were lied to, but those are rare. That's why we read about them. And most public health officials are screaming from the mountaintops. And even in those situations, you had good, solid public health people who were saying, wait a minute, this isn't right. I also think that for some reason, we've given people some sort of permission to be the worst versions of themselves in public. And I'm not sure why. I'm not blaming anybody. It's just something that has happened. And to threaten any public official for any reason just because you disagree with them, to me is just it's not good manners. It's not good community. It's not. So
it doesn't further
matter.
anything.
When it doesn't further anything, and I think what happens is, it keeps really good people from running for office or serving in those
right.
spots. Because
absolutely.
Who would want that, right?
Well,
and so then you end up with people who aren't qualified, who aren't the best. And again, we get the government we deserve. So if we're going to get really great people in those roles and really great government, we really need to understand it's a hard job. Mm-hmm. They don't get paid what they could in the public sector or in the private sector.
24/7.
And it's 24/7. And even if you disagree with them, let's find a way to have discourse in a way that is respectful of one another. Nobody needs to shout. And none of those people had bad intentions. None of them. Even I don't believe most vaccine opponents have bad intentions. They just believe fervently in what they believe.
Well, and if they're only hearing from constituents that say one thing,
right,
they don't know that there's anybody else over on the other side. So
I think we all have to take a step back and look at ourselves and say, what role can we play in this? And
right.
and call people out when it's bad behavior and just say, look, we all got to be in this together.
Right. Well, and although we're here in Dayton today, I do have to give a shout out to Columbus Public Health and Franklin County Public Health who did a great job. And actually, we had a guest from Columbus Public Health, Rebecca Nelson, who's one of their communications folks who came in and did a wonderful podcast with us earlier this year on what's going on and all that they do.
And stating the facts, just so you were talking about that when it goes well, everybody knows about it. When it goes bad, everybody, it just,
that's the dilemma.
That scenario.
Absolutely.
Yeah.
And most public health people don't want you to know their name. They really want to just do their work.
Yeah, exactly. Well, Sara, Vicki, thank you so much for being with us today. I think
thank you.
For me especially, it gave a lot of light to what this House bill is all about. And hopefully it does as well for our listeners too, to act upon it with your own conscience, I guess. When it comes down to it, think about it, be educated about it. It is a choice we have to make. And
And don't be part of the silent majority.
Right.
Yes.
Go do something about
And
it.
if you think that legislator is doing a really bad job, then run for office.
That's a great idea.
True too.
Yeah, vote and make sure you are registered to vote and vote.
Yeah, exactly.
There you go.
Well, and we want to give a special thanks to our presenting sponsor, I guess you could say today, WordBridge Now, being part of their summer celebration here in Dayton and first annual. So we know it's going to continue to get bigger and bigger and bigger, and hopefully the owner will ask us back.
Well, and I think we've already asked the owner to do a podcast with us, so that's coming up.
That's true too. So
in a month or so.
We'll see.
Exactly. Since we have an in with the owner.
Yes, we do. Yes, we do. Yeah.
Sarah and Vicki, thank you very much. I know you're busy, and I know this has been crazy. Sarah's giving testimony here pretty soon to the Ohio legislators.
Yes, I get to follow last week's supporters of the legislation on Tuesday. I'll be there at 10 o'clock, and this will probably be broadcast after.
Yes.
But Vicky's going to be by my side, and I will be brief, I hope, that I won't be on CNN or anything after that.
Well, if they let me into the chamber, I'll be out there going woo-woo.
Yes.
Sarah.
I want Carol there with me, in addition to Vicky and anybody else. Though I'm not sure why I'm the one doing this and not some of the other infectious disease specialists at St. Jonas Hospital.
I think you're the perfect person.
No,
so we're excited about.
And we've given you practice today.
You did. You
Right.
did give me
There you
practice.
go.
Thank
There
you
you go.
so much. I
So
appreciate this.
for our audience, we're going to have lots of information for you, and we're going to be publishing this timely, so we'll have time to get to your legislators and talk to them about House Bill 248 and whatever it ends up being in the Senate if it's passed over to the Senate and to the governor's office. So thank you both very much for being with us today. We appreciate your time, effort, expertise, and hopefully you'll come back with good news with us sometime.
I hope so. And don't forget, don't pass up the chance to get your shot.
Yes.